For millions of Americans, losing their jobs during the pandemic could also be bad news for their health. A new study reveals that roughly half of the American population has health insurance that's provided by employers, and 7 million wouldn't have access to any alternative if they were made jobless. Maupin has more.
In April, the United States lost roughly 20 million jobs. And a new study indicates that 43 million Americans are in danger of losing their health insurance at a time when a pandemic is sweeping the country and access to health care is more important than ever.
The status quo is incredibly inefficient. It's incredibly unfair. It's tied to employment for no real reason. This problem exposes a lot of the inadequacies in our system.
Now, before the pandemic broke out, roughly 160 million Americans had access to health care through their job. Now, for those who lose their job due to layoffs, they have access to health care, including Medicaid or the COBRA law. Quite complicated. Polls show that 68% of Americans don't know what their options would be if they lost their job when it comes to health insurance. Furthermore, research indicates that 7 million Americans are unlikely to find a new health care plan if they lose their job.
Who's going to pay for it? Last words I'll never forget. The response my patient gasped out between laboured breaths to me and my team after we explained that he needed to be intubated and placed on a ventilator.
Now, this is not just bad for individuals. It's bad for the health of the entire country. It means people not going out to seek the help they need and staying sick.
1 out of every 7 U.S. adults report that they would avoid seeking health care for a fever and a dry cough due to concerns about their ability to pay for it. When framed explicitly as believing to have been affected by the novel coronavirus, 9% still report that they would avoid seeking care.
Left-wing voices have certainly been raising the alarm.
20 million people lost their jobs last month. The American people don't want their health care tied to their employment. They want Medicare for all.
During the pandemic, in which millions have already lost their health insurance, we need to be guaranteeing health care for all, not taking it away.
Lack of health care for the unemployed may also explain the desperation of some Americans to end the lockdown.
Hey, ho, ho! End the shutdown now! When the government fears the people, there's liberty! USA! USA!
While other countries have built up bigger welfare states, the United States has long stuck to the mantra, if you want things in life, you've got to work for them. So, in a pandemic, when people are actively prevented from working, you can understand why the desperation and fear is rising. Maupin, RT, New York.
The former Ecuador president and RT host, Rafael Correa, discussed the US health crisis with Pink Floyd co-founder, activist and New York State resident Roger Waters.
Has the New York pandemic been a shock?
Yeah, but you would expect it because there's no health service in the United States of America. Well, there is a health service, but it's only for the very wealthy. And in consequence, they're completely unprepared, really, to face something like this. And also, they're not used to acting together as a community. And in consequence, this is hitting very, very hard.
Do you expect significant changes in a post-pandemic US?
Yeah, well, that's the big question at the moment. I hope so. I mean, I hope so. Wouldn't that be great? This election that's coming up in the United States in November, if it happens, will be a great indication of that. Though, well, let's not. We could go on to that subject, but it's not much of a choice, frankly.